Welcome to Health Code Blueprint. Today, we're diving into one of the most significant ICD 10-CM updates we've seen in years. The April 2026 addenda introduce major shifts that directly impact coding accuracy, sequencing, and clinical interpretation across multiple chapters. Before we begin, here is our disclosure. This presentation is for educational purposes only. It does not constitute legal, compliance, or billing advice. Always follow official ICD 10-CM guidelines and organizational policies. This year's headline change is the widespread conversion of Excludes1 notes to Excludes2. This shift relaxes long-standing mutually exclusive rules and allows conditions that were previously blocked from being coded together to now coexist when clinically appropriate. The key takeaway: do not assume permissibility. Verify each Excludes note in the tabular list. In the neoplasm chapter, several benign and vascular lesions now allow dual coding. For example, glomus jugulare tumors and certain nevi have shifted from Excludes1 to Excludes2, meaning they can now be coded alongside related hemangiomas or vascular nevi when both are present. This change supports more complete clinical representation of benign growths. Several long-standing exclusions have been lifted. Vitamin B12 anemia, other B group deficiencies, neutropenia, DIC, and certain endocrine disorders can now be coded together when clinically distinct. This unblocks comorbidities that frequently coexist in real-world patients. A key update involves post-concussional syndrome. F07.81 now instructs coders to code also the sequela of concussion when applicable. Additionally, the Excludes1 note for current concussion has been clarified to apply only to initial encounters. In neurology, migraines and generalized headaches can now be coded together, a meaningful shift for chronic headache patients. This is a major logic change. For neovascular secondary angle closure glaucoma, H40.84, the underlying condition is no longer required to be sequenced first. Instead, the instruction now reads code also, giving coders flexibility to assign glaucoma as the principal diagnosis when it is the focus of the encounter. This is a significant shift for ophthalmology coding. Hypertensive crisis, I16.1, now uses the instruction code also instead of use additional code, emphasizing the importance of capturing organ dysfunction such as AKI, MI, pulmonary edema, or stroke. Rheumatic aortic valve disease and Fontan circulation also received updates that expand coding permissibility and clarify sequencing. Across multiple chapters, Excludes1 notes have been replaced with Excludes2, allowing more accurate representation of complex conditions. Post-procedural respiratory failure can now be coded with other respiratory failures. Anal fissures, fistulas can coexist with abscess or cellulitis codes. Heartburn and dyspepsia NOS can be coded together. Vaginal disorders now allow concurrent coding with senile vaginitis. These changes support more complete documentation of overlapping conditions. A critical documentation update. BI-RADS terminology now uses categories AD instead of numerical levels. Coders should ensure that templates, macros, and provider documentation reflect this updated language. Psychotropic drug poisoning codes, T43, now allow concurrent coding with barbiturates, benzodiazepines, and appetite depressants. Methadone usage, Z79.891, is now Excludes2 for methadone dependence or addiction treatment. This means therapeutic use and addiction treatment can be coded together, a major clarification for substance use documentation. New Y92 codes expand specificity for injury locations, including highway rest stops, schools, service areas, single-family homes, transport vehicles. These updates support improved injury surveillance and public health reporting. To close, here are the key steps for HIM and CDI teams. Review sequencing changes, especially for glaucoma. Update mammography templates to BI-RADS categories AD. Query for specificity in injury locations. Capture comorbidities newly allowed under Excludes2. Always verify Excludes notes. Many have changed, but not all. These updates reflect a broader trend toward flexibility, clinical accuracy, and alignment with real-world patient complexity. Thank you for joining this walkthrough of the 2026 ICD 10-CM updates. As always, consult the official guidelines for final code assignment, and continue building coding practices that reflect both compliance and clinical truth. See you in our next video.